How do patients find out about clinical trials they are eligible for? When should they consider participating in a clinical trial?
So great questions all. I am a clinical trialist, so I'll say that up front. I'm a firm believer in clinical trials being the best way to treat oncology patients whenever they're available. There are definitely trials open in CLL at every stage. So there are frontline trials, there are relapsed trials. So anytime a CLL patient is considering treatment, I would encourage them to ask their oncologist about the availability of a clinical trial. Um, there are websites that can be helpful. So there's clinicaltrials.gov, where if you put in and search for CLL, you'll be able to pull up all the clinical trials that are registered at clinicaltrials.gov, which is essentially all of the clinical trials because it's a requirement by the government that those trials are registered there. So that's a really great resource. And there are a bunch of organizations, much like HealthTree, that can put patients together and have message boards and the like for sharing information about studies and their availability. And so I would absolutely encourage patients to talk to their oncologist when they're considering treatment, either upfront or in the recurrent setting, about clinical trials. And if your oncologist doesn't have one open, and that happens, absolutely, there are lots of sites that don't currently have a trial for that particular indication, then I would encourage them to think about, talking to their oncologist about can they get a second opinion someplace that maybe has a clinical trial. And I would really emphasize that anybody who's treating oncologist is upset by the thought of them getting a second opinion. That's that's a little bit of a warning sign. Your doctor should very much be happy with you getting a second opinion. The more brains that are thinking about your disease and the best treatment for it, the better. And so it would be a bit of a red flag for me if an oncologist said, I don't want you to get a second opinion. And we generally, I can tell you, I am personally never offended by it. I always am happy to encourage a patient to get a second opinion, especially if I don't have a clinical trial for their disease.
It's definitely something to talk to your doctor about actually at every stage of the disease course, because in CLL, we have clinical trials, um, that are for patients who actually, even before treatment, some of these supportive care measures like prevention of infection, the immune system effects that might be available to you. Here at Memorial Sloan Kettering, for example, we have clinical trials that are attempting to refine and even improve the standard of care for the initial treatment. And then in the relapse setting, there are patients who've had many treatments for their CLL, and we have trials that are looking at new drugs for CLL, really first in human trials first. So for CLL, it really depends where you are in the disease course, but a clinical trial could be appropriate for you if available at really any stage. And that's what we really do in our CLL program here at Memorial Sloan Kettering. And so I would say, at any time, talk to your doctor. Clinicaltrials.gov has a listing of the CLL trials, and your doctor can discuss what the standard options for you are outside of a clinical trial, which is always really important to know, and then see if there's a clinical trial available, no matter what really stage of the disease you're at.